This is a lecture for Part 2 of Chapter 5, Diseases and Disorders of the Eye and the Ear. And the first thing that you should do before even studying the abnormal conditions is familiarize yourself with the normal functioning of the organ of hearing, of the ear. There's a wonderful diagram in your book that shows the different parts of the ear, such as the little tiny ear bones, and the semicircular canals and the cochlea. Within the introduction to Chapter 5, this second part, Disorders of the Ear, common symptoms of ear diseases are listed. Certainly hearing loss, and I'm going to talk about hearing loss in detail. Ear pain or pressure would be a symptom of an ear disorder. Tinnitus is ringing, an abnormal ringing sound in the ears. Vertigo is dizziness because your inner ear controls balance. If there's problems in the inner ear, you'll have problems with balance and dizziness. Nausea and vomiting also because of inner ear problems. The first condition to look at is ototoxicity that is actually described in an alert in this chapter. Just kind of a warning of the damage that can be caused by certain drugs and chemicals. Ototoxicity, damage to the 8th cranial nerve. The 8th cranial nerve is referred to as the acoustic nerve. That is the nerve that allows you to take the messages received by this receptive organ of hearing to your brain. The 8th cranial nerve takes the message of hearing to your brain to be interpreted. And at ototoxicity, there's damage to that nerve. Examples of some of the drugs that can cause ototoxicity: aspirin and aspirin-containing products, non-steroid anti-inflammatory drugs like ibuprofen. And this would be a use, abuse, and overuse of these products that would result in the ototoxicity. Certain antibiotics, certain cancer chemotherapeutic agents. Patients that have been treated for cancer with aggressive chemotherapy with certain agents, they'll be left with a certain degree of hearing loss. I've got a note of the insidious onset of symptoms. It's a slow onset, including the ringing of the ears, the tinnitus, pressure in the ears, vertigo, nausea, and eventually the hearing loss. Okay, the next condition to look at is otitis media. Otitis is inflammation of the ear. The medical term for ear, the medical word part is OT. So otitis is inflammation of the ear. Media is referring to the middle ear. The middle ear between the tympanic membrane, which is commonly called the eardrum, and the oval window, which is kind of the divider into the inner ear. This is middle ear inflammation, which could be infectious due to some type of infectious organism, or it could be an inflammation due to an allergy. Two types. The serous otitis media, the patient has clear fluid, and that's the non-infectious type. The suppurative is with the purulent fluid that is caused by bacterial infection. The suppurative type is more painful and is usually accompanied by the systemic signs of infection, like having fever and just feeling bad all over because of the infection. Treatment will be according to the cause. Certainly if it's bacterial, then antibiotics will be appropriate. If the person is just has congestion with allergy problems, then antibiotics are not appropriate, but decongestants would be, and antihistamines. If a person, especially children, are prone to otitis media, if a person has case after case of otitis media, the physician may recommend what you've probably heard of as having tubes in their ears. Placing of the tube is called a myringotomy. The myringotomy is the making of the hole or making an incision into the eardrum. And the actual insertion of the tube is the tympanostomy. So the myringotomy with tympanostomy is pretty common in children that have recurring bouts with otitis media. The insertion of that tube, there's a great picture in your book of the myringotomy with tympanostomy. The insertion of the tube allows for the drainage to get out of the middle ear, for the drainage to actually come out of the ear rather than building up and causing damage and additional pain. If the person is allowed to have that infectious fluid continue to build up inside the middle ear, they may actually have a ruptured eardrum. And it's much better to make the surgical cut and insert a tube than to have the rupture. Okay, next condition to look at, we're going to skip over a couple and look at Meniere's disease. This is a disorder of the inner ear. And I told you about the inner ear. It's called the labyrinth, where you have the nerve cells that control balance. If a person has an elevated endolymph pressure within the cochlea, within the labyrinth of the ear, then they're going to have symptoms of vertigo, that dizziness, tinnitus, the ringing or roaring in their ears, progressive hearing loss, nausea, vomiting, sweating, loss of balance. They just feel miserable when they have this attack of Meniere's disease. And it's a recurring thing. At first, it may only last a few minutes. It may only last a few hours. It may last several days. It's a very miserable feeling. And you might wonder why I have the self-portrait of Van Gogh, if you recognize that, in one of his very famous portraits, his self-portrait, and one of his other famous paintings. Legend has it that he had Meniere's disease, and that he literally felt that he was losing his mind because of these signs and symptoms that they did not have treatment for at that time. And the self-portrait shows that he cut off his ear, which further supports that he was having the problems with his ears. Treatment now, we've got treatment, but we don't have a cure. The treatment is pretty much just to sedate the person, and for the person just to stay in bed taking sedatives and hope that it goes away really quick. Taking antiemetics, which are anti-nausea drugs. Now, under treatment, there's some recommendations of long-term treatment, including salt-free diets, restricting fluid intake, antihistamines, diuretics. There's surgery that can be performed, but it's usually not a permanently successful surgery. Okay, two main types of deafness would be conductive deafness and sensorineural deafness. I'm skipping several conditions here over to the last couple pages of the chapter. Under sensorineural hearing loss. Let me talk about sensorineural hearing loss first, and then I'll get back to the conduction. In sensorineural hearing loss, the problem is with the nerves, and that is definitely the more difficult type of deafness to treat. There's impairment of the cochlea. There's impairment of the actual nerves that allow a person to hear. The sound waves reach the inner ear, but they're not perceived. And this can result from the aging process, or listening to loud music or other loud sounds, machinery on the job, for instance, and can also be a side effect of certain medications. The damage is irreversible, so prevention is essential. Sometimes a patient can be treated with a hearing aid, but more likely to truly regain hearing, they'll need something like a cochlear implant, and that's appropriate for some patients, but not appropriate for others. The other type of hearing loss is referred to as conductive hearing loss. The conductive hearing loss occurs when a person has something that is preventing the sound waves from actually reaching the inner ear. If you'll turn back to the very beginning of this section of Chapter 5 on disorders of the ear, under functioning organs of hearing, and if you'll read over the description of how the sound waves actually reach the inner ear, you'll understand that there's several organs, several parts of this organ that are responsible for conveying the sound waves. If you look at the picture, first of all, the sound waves have to enter the auditory canal. And if there's something stuck in a person's ear, like too much earwax, it's not possible for the sound waves to even reach the eardrum. Once the sound waves reach the eardrum should be able to vibrate and start a vibration through the ossicles, those tiny ear bones. If the tympanic membrane is ruptured, then the person will have difficulty beginning those vibrations from the sound waves. If there's a problem with the ear bones, the malleus, the incus, the stapes, if one's dislocated or cracked, then they're going to have problems with, or there's a condition called otosclerosis, a hardening of those ear bones that will cause a problem with the conduction. So there's several things that have to be in place for the conduction of the sound waves to the inner ear. Now, if someone does have conductive deafness, these cases are usually treatable. It may just be cleaning out the ears. It may be an operation on the tiny ear bones. But there's microsurgery that can be done to correct conduction deafness. It's just much more difficult to correct the sensorineural deafness. This concludes Chapter 5